is going to affect resistance. It's, again, pretty straightforward. So one of the things we want to look at is we want to see how can we generate this pressure gradient, right, to allow for airflow, and what are factors that may affect resistance here, especially with regard to bronchial diameter. And to understand this, there's a couple other little issues we're going to have to explain, and one of them has to do with preventing lungs from collapsing. You heard about people having collapsed lungs. When someone has a collapsed lung, they cannot generate a large enough pressure gradient, for reasons we'll chat about in a minute, to allow for airflow. So that's why collapsed lungs are. They're really, I shouldn't say fun. If you ever get to volunteer in a hospital, try to spend some time in an emergency room, because you'll learn so much and get to see so much by volunteering in an emergency room. Lung collapses due to chest traumas are exciting to see people work on, but they're also to hear what's happening with that. For reasons we'll talk about in a minute, they're called pneumothorax because air rushes into the thoracic cavity, and you can hear air actually being sucked into the thorax. So they call them sucking chest wounds, and because of that, the lung collapses and the person tries to breathe. They can't do it. Anybody ever had the wind knocked out of them? You ever had that? That's what it feels like. That is a lung collapse due to, basically if you push up on the diaphragm, you squeeze the air out of the lungs like this, and they collapse manually. But eventually, because they're elastic, what do? They'll open back up, and then you can breathe again. But it's not quite so simple if someone has a pneumothorax and a lung collapse. All right. That seem okay? Kind of basics.